So if you think of that, you have 100 employees, that'd be 1,800 claims or invoices coming into that healthcare plan every single year. So I think when we think of it that way, you think, wow, like this is actually probably my largest area of accounts payable in my entire company. Where else would I get 1,800 invoices in any business department or unit or cost or supplies or, there's probably nothing like it. So this is a time to realize like the CEO, the CFO, human resources, we need to have a couple roles in the company all focusing on this problem to ask better questions. Because if you have a CFO also in there, they're going to say, well, what was the problem with our claims? Well, this was. Well, give me some details. Like, how can we pay less? What are we going to do to avoid these problems, right?
Welcome to the Sharpen the Spear podcast, where we help home service pros cut through the noise, sharpen their business tools, and reclaim the profit, freedom, and impact they've been missing. I'm your host, Richard Walsh, Profit Freedom Coach, and I'm here to help you stop grinding and start growing. Let's sharpen the spear. And we are back on STS, Sharpen the Spear podcast, with another incredible guest. I've got Donovan Ryckis with us today, and I'm not even going to tease out what we're going to talk about. I'm going to let him do that. But Donovan, as we always do on the STS, no one knows Donovan better than Donovan. So Donovan, give us that backstory, and then we'll get into the conversation.
Sure. So my name is Donovan Ryckis. I'm the CEO of Ethos Benefits. It is a employee benefits consulting agency that I founded and came into the industry kind of by accident, which is kind of a joke. Everybody does. If you look at the healthcare industry, particularly employer-sponsored healthcare, no one would want to get into it because it's been a horrible industry for the employees, for the employers. Obviously, costs have done nothing but skyrocket over the past 20 years. But I got a funny introduction actually coming from being a securities advisor and a fiduciary securities advisor. And I was loving it working with my ideal clients, but I came to find out one day that I wasn't solving their biggest problem in 401ks and pension plans was actually healthcare. And that's kind of my journey and how I got started into it.
Yeah, I think a lot of us get into stuff without, I don't say we don't plan, but like just life's full of pivots, you know what I
Yeah.
mean? And opportunities. So sometimes you go into something because like you see an opportunity, you may not even know the whole ins and outs of it, but you see the opportunity to make change or make money or hopefully both.
Yeah.
Okay, that'd be ideal. So is that kind of where you landed with that?
Yeah, I mean, you know, obviously like 401k lawsuits have been a problem for employers for a long time. So part of what I was doing as a securities advisor was I was working with business owners not only on their personal finances, but also working on stuff in the company. So that could be a combination of 401k and pension plans. And I was doing good work. If you lower expense ratios 25 basis points for the employees, that's not insubstantial when you're looking over, 10 years, 20 years, but that's 0.25 of 1%, right? And like I said, just kind of accidentally had one of my clients ask me to look at his healthcare problem. He had a large publicly traded broker, does about 7 billion a year in revenue. And this broker saddled him with I believe it was 37% renewal increase on his
Well,
health care to 120 employees. And he said, this is it. This is your last option. I got nothing else for you. And that's kind of where where I jumped in, was asked to look at it. And I didn't know anything about it. But the difference with securities and insurance is that fiduciary aspect. So coming into something, aligning yourself with the client, being transparent, not having conflicts of interest. So not knowing anything, not doing anything in health insurance before, I kind of just approached it from that angle. And the end result was 40% under that renewal. So we actually saved a little bit even from where he was currently. And we didn't pass any cost increase to the employees. We didn't increase their deductible. We didn't increase their premium. We didn't put them in a smaller network or reduce their benefits in any way. And it was kind of an eye opener to me to see like, okay, it's not because I'm brilliant. Um, Inherently, there's some conflicts in here that the broker didn't want to clear. And that's why he was saying, hey, your only option is to renew with the same company I placed you with.
yeah, is that and I'm totally guessing here, is that laziness? Is it a conflict that's going to benefit him by
Yeah,
not lowering it? Is that really the reason, or is it a combination of the two?
it's a combination of things. So the first one is I mean, it's kind of in the name. So what companies would call that person is their employee benefits broker, right? So inherently we have to remember what that means. And that means the broker is trying to sell a risk transfer to an insurance company. The bigger the transfer, the bigger the commission. Also, when you retain clients with a certain carrier, you get paid retention bonuses and increases in premium growth, right? So it's certainly one, the easiest thing to do. Second, yes, certainly they had huge quarterly and annual bonuses tied to it. Um, and then, yeah, I mean, like when you're compensated that well to do the easy thing, like how hard are you going to work to do the hard thing, right? Like how much are you going to dig? And then there's some other pieces in healthcare, which is basically a lack of data and reporting on healthcare spend that also kind of eliminates a lot of the questions you would ask. So that's where I came in. I'm like, there's 120 employees and I'm looking at this and I'm thinking there must have been thousands of claims during a 12-month period, right? Pharmacy claims in primary and specialist urgent care and ER, right? There had to be thousands with all the dependents on there. And that whole thing was summarized on one page in about two paragraphs that, hey, you're going to pay 37% more. So that was the other thing, coming at it from a financial advisory perspective. I'm like, hey, where's the data? Right? Like that's not what I'm used to. I'd expect to see every claim down to the penny to figure out what went wrong and to come up with solutions to fix it. And that's kind of the path I started down to solve that problem for him.
Yeah, I've noticed that too. I've talked to a few different individuals on these subjects. Of course, clients I have in business, other people I know in business, and this healthcare thing has always been the issue, right? It's the thorn that never
Hmm.
gets removed from your side.
Yeah.
You know what I mean? It really is. It's just, and sometimes and all you get to do is lessen the pain a
Yeah.
little bit. That's the thing. But I think that the big thing to me is like what you just said: this transparency, this conflict of interest.
Hmm.
Because if a broker, again, multi-billion company, whatever, and he's getting these retention bonuses, he's getting all this stuff, he has zero incentive to truly help you.
Yeah.
Saving where I mean, he's incentivized for the exact opposite,
Yep. Yeah. We
right?
call it
So
reverse incentives.
yeah, yeah. So it's like it it's irritating, it's
Yeah.
anger, it's angering, if that's a word. Okay, it's like
Yeah.
I think about it, just like you just, and I tell people the story with my not health insurance, but just basic business insurance.
Hmm.
I thought I had the great agent. All this stuff is all good. I was paying about 23,000 a year. I got trucks. I got some other stuff. Okay, and I had a friend of mine who owned a landscape business. His insurance guy's there, and he's like, "Hey man, you mind if I just compare your numbers? I'm good, man. My guys, he takes care of me. He's great, right? It's one of those life lessons." So a couple years go by. Every year he asks me, maybe every 6 months, "Sure you don't want me to?" I'm finally like, "Okay, man, do what you got to do." You look, I'm just going to do apples to apples. Okay, so I'm paying over like 23.5 a year. He came back, it was like $6,500, $6,700 for the same thing.
Yeah.
Okay, and
Yeah.
I'm like, what? He goes, and I'm going to tell you, you can go with me. That'd be great, but you still should shop. Every year
Hmm.
or two, you should do the same thing. Like you should shop.
Yeah.
Like you can't be. And I was like, I was hot, Donovan.
Hmm.
I'm thinking this guy was all about me, and they're not about you.
Yeah.
He wasn't. I just was like, dang, that's a lot of money. That's pure profit in my
Yep.
business. I'm like, dang, that's like $16,000, man, pure profit. So yeah, I get it. That's why I'm a little, again, I'm a little more hypersensitive to the stuff when I hear it. And then my clients, same thing, working through this, they're staying at 49 employees because if they have 50, they have to have the benefits,
Hmm.
and
Yeah.
stuff like that. So they're like, well, I can't have 50. So now it stunts their growth,
Yeah.
right? They
Yeah.
can't grow.
That's
So like, I'm like, I'll try to wrap my head around. I'm not super great at it, but I'm like, all like in business, and as it could, you see there's a lot of obstacles,
hmm
and this is just one of them. It's a big one,
Yeah.
right? So yeah, so I just Talk a little bit about that because I think people, whether they're in business, a lot of my listeners are business owners, but a lot of people who aren't or thinking about getting in it. Like, I don't think they understand. I can use the word complexity, but
Hmm.
also just
Yeah.
the burden of this, So kind of talk on that a little bit.
Well, I think a great framework and thought process for any of these is a really great quote I love. It's from a very old English British theorist. And the quote is that the purpose of a system is what it does. So therefore, we can't say that the purpose of a system is something that it repeatedly fails to do, which I find really interesting. So the thought process, like in my business with employers, is they think, well, it's my broker's job to keep those costs low, kind of like the thought process you had, right? It's my guy's
Mm-hmm.
job, and I like him, I trust him, he'll keep the cost low. Or my insurance carrier will keep the cost low because they want to keep me as a client. They don't want me to go to another insurance company, right? But then if we kind of step back and view it through that lens, through that quote, right? Has that worked over the past 20 years in employer-sponsored healthcare? Absolutely not. So either they've been failing for the past 2 decades to do their purpose, or their purpose is actually something else,
Yeah. Yeah.
right?
I'm gonna go with the latter.
Yeah. So, this year in 2025, the average cost of a family of four on an employer-sponsored healthcare plan is $35,119 annually.
Wow.
That's that. I mean, we're at a breaking point, and that's a cost that's split between the employer and the employee. And it's too much for either. It's too much split, right? Like it doesn't work for either. As an employer, you can't add 35K on to somebody's wage because they have a spouse and two kids. Like that's unsustainable. As a working person, you can't pay 35,000 for, your starting point of living before you focus on your house and your groceries and your cars and everything else, right? So we're just kind of at this breaking point where companies really need to view this harder. And then also there's been some recent legislation and litigation in the space as well, kind of forcing that issue.
Yeah. So what really is the solution? If it's not
Yeah.
sustainable, which I totally get, it's
Mhm.
it's an unbelievable burden. So like let's hit some solutions.
Yeah. So I would say the starting point is alignment. And there's two types of alignment. One is internal alignment and then external alignment. So internally, I'm talking about how a company goes about making that decision. So in a lot of companies, this decision is pushed down to just one department, which is human resources, because the companies have been led to believe that the decision is pick the least worst out of the 2 to 3 carriers that are in my area, right? And that's easy enough decision. Just pick the least worst and then we can move on. Do this again in 10 months and have a 60-day crunched timeline to do it again. So what we see on average is per insured employee, there's about 18 claims per employee per year. So if you think of that, you have 100 employees, that'd be 1,800 claims or invoices coming into that healthcare plan every single year. So I think when we think of it that way, you think, wow, like this is actually probably my largest area of accounts payable in my entire company. Where else would I get 1,800 invoices in any business department or unit or cost or supplies or, there's probably nothing like it. So this is a time to realize like the CEO, the CFO, human resources, we need to have a couple roles in the company all focusing on this problem to ask better questions. Because if you have a CFO also in there, they're going to say, well, what was the problem with our claims? Well, this was. Well, give me some details. Like, how can we pay less? What are we going to do to avoid these problems, right? CEO is going to help lay out a strategy in a multi-year and understand where have these costs been? Where do I need them in 3 to 5 years? So that's internal alignment. External alignment, we kind of touched on when we started, which is the idea of the person that you hire to help navigate you through this very complex scenario and situation that's ever increasing, they certainly shouldn't be paid when you do worse. And you're the person hiring them, right? As the plan sponsor, as the employer, you can tell them you want that compensation any way you want. You could set it to strictly fee based. You can set it performance based to where they get more money if they actually reduce your costs instead of increase. And you can certainly ask, what are their bonuses for this carrier versus that one? And that should all be disclosed as well. Like, are you going to get paid more if I hit the easy button and renew? Because, even if there is a proposal, the proposal that they put together is going to look really good compared to the options they never investigated at all. Right.
Yeah.
And that's where a lot of companies kind of stop at. They're like, well, I did this last year and I saw it and it looked good, with what he showed me and what he suggested. It's like, yeah, that's intentional. Like, certainly if there's a recommendation, it's going to look good for what they're looking for. But how about to the things that they didn't investigate, the questions we didn't ask?
Yeah, that's the key, right? You got to know what to ask.
Yeah.
I mean, it's a, like I said, it's a complicated industry, or it's
Hmm.
made to be complicated. And it's just when you don't know, you don't know. So
Yep.
now again, you have to go back to trust on that broker, or what
Hmm.
do you have there? Like me, you taking care of me? Seems like it, but I don't know.
Yep.
So that's where I think, and it's time consuming. It's
It
very, very
is.
time consuming.
It is. And every business has their own actual operations to run. They're certainly not in the
Mhm.
healthcare industry. So they really need a consultant or an advisor, not a broker. And
Right.
the difference between those things is that compensation piece, right? Because a broker, when you have a bad year, they'll just look to package that up and to sell that risk transfer to someone else. But that doesn't fix any of the problems, right? If you're telling me these are my problems, like, okay, how is jumping ship from this carrier to that carrier? How is that changing our strategy? How is that getting rid of some of these problems, right?
Yeah, that's kind of a key. I again going back to the lack of knowledge. Um, you don't know what the problem is,
Yeah.
right? You're getting this kind of feedback, these outcomes, but you don't know, like you're saying, the lack of data.
Hmm.
Okay, like you don't know what's creating these outcomes.
Yep.
That's the problem. So like you're stuck in that cycle because you don't understand whatever you're doing here is going to cause what. It's going to
Yep.
cause this, but if I can I change this so I
Hmm.
don't get that? That's what we're looking for.
Yeah. So let's talk about step two. So first one would be alignment internally and externally. So get the process started. Second one would be really the only strategy, the only goal here is how do we reduce the frequency and severity of claims? Now, when I used to say claims, I didn't realize for a little bit that a lot of companies didn't understand what I was referencing. Because when they heard claims, they thought I was saying reduce the frequency and severity of basically medical conditions, is what they were thinking. Because they're like, well, my people have what they have, they need to be treated. That is not what we're referring to. Of course, the employees are going to have their medical conditions, they need treatment. A claim, the definition of a claim is actually a request for dollars for a covered incident. And that request, that dollar amount, is wildly variable for the same incident, for the same procedure, for the same drug, for the same hospital, right? And that's what we need to measure, right? Imagine being like a construction company and you're building houses and instead of knowing and understanding the cost of your supplies, you got one annual invoice and it just said wood, right? That wouldn't be sufficient.
Yeah,
You'd be like, no, my sheets of plywood cost this, and my 2x4s should cost this per 10 feet. My 4x4 is this, right? And you would be checking that, tracking that, checking suppliers, right? Same thing with healthcare, right? So if we send 10 people into the same hospital with the same condition, but we give them 10 different insurance cards, they all leave with a different price. They have a different price, the insurance paid a different price. Same thing with pharmacy and sending people in to get a prescription, right? And if you don't know and you're not having conversations about how those prices are determined and where you benchmark, I promise you it's not on the good side.
yeah, yeah. I can agree with that. I've been it's pretty blessed of just from a life standpoint. Like I've always been healthy.
Yeah.
My kids. I got 6 kids. Wife, and like we grew them up like, well, let's be really healthy. So we don't need, how do we minimize other than accidental, ER stuff like whatever, you broke your arm. Okay, we'll go get that fixed. And we've been pretty fortunate, not perfect by any means, but we look at that too. And that's when you told me like you got 120 people, 1,800 claims, I'm like, dang, that's a lot.
A lot.
That's a lot of business. Oh my gosh. Like I mean, that was kind of a shocking number for me. I'm like, because I don't know, but I've never really run the numbers on my own family
Yeah.
because it's so infrequent. I'm
Yeah.
like, it's not like I'm trying to, here we are, so that's fascinating. I've done a lot of cash work. We have different doctors. I'm in Wisconsin and stuff, and guys, you just literally like, dude, it's cash.
Yep.
Come in, I'm pay cash. And it's super cool. Like not, just a very different way to, and he's awesome. And we go in here. That's just how much,
Yeah.
you know?
And we'll design healthcare plans that operate that way as well, because the things we see are just absurd. You want to hear an example of like a
Yes.
hospital claim? So, great example. We had a hospital claim. Employee got bitten by a spider and he needed like a brown recluse. He needed
Mm.
a little skin graft on his pinky, smallest finger, right? He went into the hospital, normal procedure, gives his insurance card. The hospital pre-authorizes basically on the back end, they reach out to the insurance company and say, hey, we're going to do this procedure. They said $86,000
Oh, okay.
for a skin graft. But don't worry, we're going to apply a 30% discount. It's only going to be $57,000. But internally, we know our metrics. So basically, when that claim comes in, it's triggered. It's tied to a CPT code, which is basically what the procedure is, and then the price. And we know the variation where our thresholds and our limits are of what's reasonable and what can get paid. And that was way outside. So he schedules this like, the employee's unaware any of this is happening. That, we designed this to operate all in the back end. So he gets his procedure scheduled, he leaves. This is happening in the back end. So 57,000 is absurd. So we're negotiating with the hospital to try to get it down. For whatever reason, they are stuck here. They think they're going to get $57,000 for this pinky skin graft. So what we did is after we realized we were at a sticking point, they weren't going to do it. We found out his same surgeon had admitting privileges at an ambulatory surgical center about 3 miles down the road. So we scheduled a procedure there. No delay in care, same doctor, different building. Want to take a guess on the final cost out the door?
Dude, I'm going to say it had to be like 4 grand, 5 grand.
Under 3 grand.
Yeah.
Yeah, 57,000. The hospital's totally stuck thinking that the insurance is going to pay it to 3 grand. Same doctor,
Yeah.
different
Yep.
building. And stuff like that happens all the time. And you can
Yep.
imagine, if you have a couple hundred employees, how many, you only need to catch a couple of those a year to really make the difference. And that's how healthcare is. It's really like a 90-10. Like 90% of the claims are coming from less than 10% of the people. So you don't need to, put handcuffs on everybody and change their processes, make everything difficult and hard. And, like all you have to do is on the back end, you're catching kind of these pricing issues.
Yeah. I had a client, his son had broke his arm, but needed a plate and all that kind of stuff. Same principle, right? I think it was 15 or 17,000 was the first number. He's like, oh, he's smart. So he looks around, found another place was 7,500. Oh, that's pretty good. I'll look around a little more. So him having to just drive to Indiana. It was about a 2.5 hour drive.
Hmm.
Same thing. As son, all the same work, got everything done, and I think it was like $3,400
Yeah.
down from 15. Got it done. And he ended up developing a whole healthcare program based on that. Really cool for the whole company. He has like the 50 employees, and he's able to roll that out. They're saving money and they shop their own thing and they get the money back. And it's really cool what he
Yeah.
built because he's always struggled with it. He's been in business 37 years doing this stuff, you can imagine. So he's finally got to the point where he figured a way out just kind of by chance, like, oh, we can do this. Like you said, you go shop,
Hmm.
you can
Yeah.
shop it.
Yeah.
Like that's,
Absolutely.
and that's one of those things, and I was a boxer. So in 1990, I got my head kind of crushed. So my cheekbone, I'd have plates, wires, new nose. I had 7 breaks. It was detached from my face. Now we have insurance. It was really cool. It's called ABF, Amateur Boxing Federation. It's $10 a year. Okay. And if you if it happens in a sanctioned fight, like legit refs and everything, they'll pay up to 10 grand. Okay. If it doesn't, they give you like 1,000. So if you're just sparring in the gym and the
Right.
same thing happens, you're getting like 1,000 bucks. So mine fortunately happened in the fight. I go in, then the guy does the surgery, it's hours of surgery, and my nose, he puts my nose back on and fixes all this stuff, this is 1990. And then he gets a letter from the insurance company saying, he told me, he goes, they're not going to pay it. They're not going to pay it 10 grand. I go, oh, he goes, I'll tell you what I'll do. He goes, I'll split it with you. Super cool guy. He's like the best plastic surgeon in Arizona, young guy. At the time I go, well, that's really cool. So I'm thinking 5 grand and, it's like 10,000, whatever. I'm like, but I don't have 5 grand. So I'm like, could you write him a letter on like what you did? And he goes,
Mhm.
okay. Donovan, I still have the letter. It was like a page and a half of stuff he did to my face. They paid it in a heartbeat, paid the whole
That's,
thing. I'm like, dude, you deserve the 10 grand.
yeah,
I
for
mean,
sure.
so, but it just was that whole experience. Like, wait a minute, I paid this and he did this. Now you're just going to deny it,
Mhm.
and it was a 10 grand. So it's always been this way. I mean, it's insurance. I mean, it's kind of a dicey
Yeah,
game.
unfortunately, that's part of the game. I mean, the insurance carriers allow this pricing discount game, you know, and that's part of, one of our biggest strategies with medical claims is we don't allow them to make up this crazy inflated price and then give us a 30 to 50% discount, but we're still 5 times over what Medicare pays every
Right.
single day for this same thing. It's like it's not going to happen. And it's part of the game because when a health insurance company negotiates with a hospital, they negotiate with all their plans. So if you think of it, if you're an insurance carrier negotiating your individual policies on the ACA, on the exchange, you're negotiating your Medicare policies and your Medicare Advantage policies. And then you also have your employer sponsored plans, right? So when they're negotiating with the hospitals, they're bundling all those in, right? Now, if they need to give a hospital more and they're hitting these tough parts in negotiation, that increase always goes to the employer sponsored side. Do you want to know why?
Do tell.
75% of businesses are self-funded.
Yeah.
So that extra claim cost goes to the employer and to the employee and not to the actual insurance company, right? So they take much less loss when they increase those prices on the private employers rather than their individual plans where they're actually going to pay.
Yeah. I mean, it's in a sense, what it seems to me, what they're doing is giving the advantage to we'll call it the larger companies with the larger marketing budget,
Hmm.
right? The ones who are going to drive that to those places that are going to we'll give you the 50% discount. It's still 5 times as much, right?
Yeah.
Because they know how to market, right? And they've built this whole whatever, the whole thing on that. And I think I was speaking with one guy, same thing. He goes, there's like do you think there's four providers? And he goes, there's like 700. He
Yeah.
goes, he's like, and I'm like, now you're talking. Because I
Yeah.
used to get all angry about what is this? Like, I got no options. I
Yeah.
got like
So
three or four people and they're all the same.
let's
It's
talk
like,
about that because that's where a lot of companies fall into a trap is they think there's, two to three options typically because invariably in some networks, some areas, the networks just won't be established. They won't have a presence there. But so step one, obviously creating external alignment. Step two was understanding the name of the game is reducing the frequency and severity of claims. Step three is understanding the parts of your healthcare plan, right? So any healthcare plan it's broken down into basically four functions, right? So the first one is just the administrator. That's essentially who's answering the phone for employees, sending out checks to the providers, sending out ID cards, all that kind of stuff. Second piece is what employees actually think of when they think or they talk about insurance to a provider, which is just the network, right? I'm in Cigna, I'm in Aetna, I'm in Blue Cross, I'm in United, whoever, right? I'm in this network. And that lets the provider know, okay, we're in that, and I know what I'm going to get paid now for this procedure. It's basically a pre-negotiated rate. But that's the forward-facing piece for employees. Third piece is the piece that's getting a lot of attention. This is where companies are facing a lot of lawsuits. That's the pharmacy benefit manager. It's where they set all the prices of the drugs, which is troubling because you start to see the possibility of self-dealing now, right? Because they're setting the price of drugs for the employer, but not for themselves, right? There's a spread there. And then the fourth piece is the actual insurance function. So, if we have cancer claims and heart attacks and heart transplants or whatever, that's what's going to cover the business. So, when we talk about brokers, those conflicts, doing what's easy, what's, incentivized
Right.
for them, it's to just bundle all those pieces with carrier A, carrier B, C, or D, right? And move on. They put it all together for you, they bonus you, they incentivize you to do that. The real consulting path is when you look at those pieces separately and you're measuring and managing each of them individually. So you can have the same network that your employees are used to, but we chose an independent administrator that feeds us back all the data that we need to make good choices. We now opened up the insurance function to 30 insurance carriers instead of three, right? Because maybe Nationwide wants to sell you the insurance, or Allstate or Sun Life or MetLife, right? Like there's all these companies that'll actually provide the insurance function. And then same with the pharmacy benefit manager. We control the pricing and we eliminate that spread pricing, and we set the prices for the company and for the employees, not for the insurer, right? So that's exactly to what you're talking about, opening up that competition where you realize like, oh, I'm not just stuck. And my broker showing me those two to three options isn't the end of the game.
Yeah, I think that's one of the big things I've learned is that it just never made sense to me. How can there only be this?
Yeah.
It's just that I'm a business guy.
Yeah. That's the
How can
most
there be?
expedient thing to
Yeah, it was
offer.
just you got four choices. I go, in what
Yeah.
world does that work? Oh,
No.
communism. That's so I'm just like like there's got to be a better way, So I've always kind of looked at that, try to and try to understand it. But I finally got clarity talking to
Hmm.
guys like you, who understand this at a different level. Again, I think the big thing, Donovan, is really serving your clients,
Yeah.
okay, in the real, with the real meaning of service to benefit them, the client. As we all need to win. We're in business. I'm here to make money. You're here to make money. We all want to.
Hmm.
We all can still win, right? We
Yeah.
can all win,
Absolutely.
and that's the goal. It's like I think with these other companies, it's like they don't care if you win.
Yeah.
Just in a nutshell. I'm just saying like that's not their priority.
Yeah. There's been very little need for transparency in this for the longest time, and that's starting to break. And it never made sense. That's kind of one of the biggest reasons I shifted over a decade ago from securities to healthcare, because I was like, 401k, those are employee dollars, which is why the lawsuits happen. Everybody takes it so seriously. It's such a big responsibility. But so is healthcare.
Right.
And healthcare costs are increasing faster than 401k balances. So finally that focus has started to shift over to this side.
Yeah, I think let's. What do you know about? So here's I'm going to go back to the 1800 claims
Hmm.
in a year. Like I'm still kind
Sure.
of swimming around that number.
Yeah, yeah.
Like what? And I'm going to use a business I know that's kind of incentivized this as well. Like you said, reduce claims, right? So there has to be like methods, and I think I know one, but like, how do you get the people? Because a lot of people just go. Oh,
Hmm.
I got a headache. I'm going to go to the ER. I mean, they do things like
Hmm.
I think there's a lot of I'll just leave them unnecessary claims, like
Yeah.
but is how can you incentivize them not to make these unnecessary claims? Is that something like you have something
Yeah.
there?
Yeah, yeah. So, I mean, it's two-part answer, two-part equation when we're thinking about it. So, one, again, when we're talking about claims, we're really talking about the dollar amounts, not necessarily
Right,
the service that was rendered or the condition and reason why it was rendered. Because back to that skin graft, right? We could have paid 57. We paid under 3 grand, right?
right.
So when we get to the end of the year and that insurance company says your costs are going up, they're always going to say it's because of the cost of claims. So we're eliminating that claim spend in those occasions, right?
Gotcha. Gotcha.
So to a secondary point of employees and how they access care, where, for what reasons, right? Because obviously, like you said, going to the ER is the most expensive way to get things done. So inherently, when we design a healthcare plan, anything that's going to reduce the cost for the employer and the plan is also going to reduce the cost for the employee, which is why they decided to do it, right? It's never employer wins, employee loses, right?
Right.
Like it truly is. And it's funny. It's hard to break people's mentality of that because when those costs go up for the company, the only choice is for them to raise the cost for the employees,
Right.
but it works backwards too, where if you lower the cost for them, it lowers the cost for you, which is crazy. So we do a lot of different things. So some things we'll do, let's talk about pharmacy side. Say they have really expensive drugs. If you have a company of 100, you are definitely going to have some prescriptions that are over 5,000 a month, up into the seven, eight, $12,000 per month. And it's
Mm.
very, very common. So, one of the options we have, if somebody's getting that drug filled at a pharmacy, they're probably paying like $150 copay every month to pick it up. So we'll set up mail order pharmacies where they can order it through the plan. And often those drugs are mail ordered from Canada or Australia or New Zealand. So same FDA standards, actually way higher. If you've ever been to Canada, you know what I'm talking
Mm-hmm.
about. And if they opt to use that employee gets a drug for free, and the plan is saving somewhere between 50 to 70% on the cost of that drug. So that's a drug example. And then on medical claims, we might do something called direct primary care. This is the idea of actually having access to a primary care physician. So this means same day or next day access to your primary care physician and 30 to 60-minute average visit times instead of 7 minutes. And when people have access to this, they'll go to the DPC for stitches, for blood work, for generic meds, for all this stuff that they would have run into urgent care or ER to get diagnosed before they get to like their breaking point with how they feel and they just run into ER because they're out of choices. So that's another an example of kind of doing that. When we put in a direct primary care in an employer, we reduce ER visits over 30% in
Mm.
that year. So lower cost visits, giving them good, quick access to what they need, eliminates those higher cost ones down the road.
Yeah, that's great. That's really awesome. I think one company I know they do. It's kind of like a health savings account. They put the stuff in and then they use
Hmm.
part of that. Then whatever they don't use, they get back.
Hmm.
So if they have 5,000 and they use 1,200, they get that balance back, get the 4,800 back end of the
Yeah.
year kind of thing, and they do that too. So it incentivizes them to be selective, to shop, like you're saying, go out
Yeah.
and find where they're at. And I don't know all the details for it. So again, this is not my area of expertise by any means, but it seems again, it's incentivized, like go shop, figure out where you're going to go and do this kind of stuff. Same principle.
It's still so hard because it's hard to be a consumer of healthcare
Yeah.
to navigate and understand those costs. Because when you need it, you're just going to go where you need to go to feel better as quickly as possible. And it's not helpful that if you try to call a primary care physician, the average wait time for your first visit is 21 days.
Yeah.
Right? Like now you're kind of left with the option of running into urgent care or ER, right? So it's still very hard. In this country, we definitely don't have the best medical system. We have the most kind of access to care, kind of, but it's still very hard to understand it, and it's even harder to actually afford it. Like it's out there,
Yeah.
um, but you have
Well,
to be willing to pay up.
yeah. What I've also seen is human nature is to be lazy. Okay.
Mhm.
That's just human nature. So these people aren't going to shop. They're not going to go, they're really not going to do the work. If you make it like more than 25 seconds worth of work, they're not interested. And I'm just, this is a really wide net I'm
Yeah.
throwing. But in general, like they're not going to do it. So they could get the savings but they're like, don't want to do that. They don't want to go here and do that kind of stuff. So, and that's
Well,
always the case. I mean, I don't care if it's
yeah.
health insurance, attendance, well, whatever it is, it seems to always be that way. You've got that human factor that
Yeah.
messes things up.
I'll tell you too, working with medical practices, most of them is a miserable experience. Like they forget that being able to actually afford care is part of caring for your patients. Like if they can't
Right.
afford it, they're not going to do it. So like they take, all the services that they do very seriously, do not harm and, do no harm and give everybody the best care. But on the front end, at the front desk, they don't care. They forget that being able to help somebody understand the costs and their insurance and if they work for them and how much they're going to get billed, that's part of the process. If they can't afford it, like you're never going to see that patient and they will go without care. And that might be the most damaging thing. It's
Right.
very hard. I mean, my team's calling doctor's offices all day. It's very rough.
Yeah, I can only imagine. I mean, it just seems to be such kind of a rigged system. It's not, if I'm a business, what I want is like ease of compliance, right?
Mhm.
How easy can you hire me?
Yeah.
How easy can we do this? How great can this, I'm all about that.
Hmm.
I'm a service
Yeah.
business, right? Like that's, and so is the medical facility. They're a service business, right? And none of that seems to have a part. They think they're exempt. They think they're exempt from that. You know what I mean?
Hmm.
Because they're like whoever they are, like they can figure. Well, I won't go down there. I'm gonna say because they can't cure anything.
Hmm.
Like they could set up bone, they could do this, but when it comes down to this, all you do is treat your symptoms. So it's kind of like this thing. I'm like, I'll give you an example. My daughter early on had extreme asthma, right? So we have to go and do little tests every 6 months, and you see the doctor, and I'm sitting there one day, and I'm doing this every 6 months, and she's blowing a little thing, and then he just prescribes something and moves some more steroids around and does this and give her all this stuff, this basket of stuff to take. And I'm like, does it ever bum you out? And he goes, what's that? I go, that you can't cure anything. And he just so we go, I go, well, you just come here and just you shuffle the basket
Hmm.
and you change you you've committed her for life. This is a
Yeah.
life sentence you've given them. We have these shots, they're $1,500 a piece,
Hmm.
twice a month. Okay. I think, and you're telling me rest of her life. And I got to tell you, my man, I don't believe it. Okay.
Yeah.
So I'm just like, but that's the thing. I'm just like, you don't cure anything. Like,
Hmm.
you guys haven't figured this out. Asthma didn't start last month.
Yeah.
It's
I mean,
been
that's
around for a
That's
while.
part of the hard problem too. I mean, those doctors, they have, on average 7 minutes per patient, right?
Mm-hmm.
It's another reason that direct primary care program works so well, because people actually sit down and they get to go through
Right.
things and hopefully, when they have that extra time, asthma might be a different thing, but there's certainly a lot of conditions where
Mm-hmm.
instead of masking the symptoms, think blood pressure, cholesterol, right? You can get back to lifestyle changes
There it
that
is.
will actually get that understanding. You'd be shocked how many people just don't really understand the impact of lifestyle changes on things like diabetes, blood pressure,
Mm-hmm.
cholesterol, like how simple it could be.
Yeah.
Um, you know, um,
I would not be
you know,
shocked. I,
yeah,
I totally get it.
I see
I've
it all the
seen
time.
it. I see people just eliminate insulin in 30 days
Hmm.
just through what they eat. I've seen all this stuff, and it's really, really good. And I think I'm going to go down a rabbit hole here, but I think those GPs, so general practitioners like that with the seven, they're going to be replaced with AI. It's already beginning
Yeah, for
because
sure.
they've even done these really cool studies where they've had a real doctor answering questions with a patient and AI answering the questions. And then people say, which one did you prefer?
Yeah,
AI smoked them. They're
yeah,
way
every
more
time.
compassionate. They're this, they ask the question because they got nothing but time in
Yeah.
AI, right? They're not worried. I mean, they can talk to 100 people at the same time.
Hmm.
You know what I mean? And they can go in depth and the knowledge is there. So I'm like, you can have your nose up in the air right now. You can do what you're doing, but the reckoning is coming. I
Yeah.
think there's going to be that, and it's just that's going to be a fascinating shift, Donovan, in the
Hmm.
medical industry. I mean, it's really gonna, people kind of don't know yet, But what I've seen coming, because I'm kind of really getting into this stuff, it's like, man, this is coming fast.
Yeah.
You're going to see a lot of changes, and not just people kind of get apps and all that, but like you have no idea what's coming.
Yeah.
Really fascinating. I'll be surprised. I'll be really anxious to see the outcome from a healthcare standpoint, from
Yeah.
costs and everything else. What is that actually going to do?
Yeah.
You know,
There'll
it's
be a
going
lot
to.
of applications. I think it's yet to be seen. And certainly on my side of the business, on the advice, the consulting side, like working direct with plan sponsors or even employees directly, like it is the slowest to change. And that's mainly because the incentives are too damn good
Right.
to look too hard to do otherwise, right? So unfortunately, like the leaders of where companies and employees would get this type of information and advice from, that gets kind of stifled when the insurance carriers want to pay over the big bucks to the people given that advice to kind of eliminate it, you know?
Yeah, it'll be interesting. You
Yeah.
know, it's going to be interesting to watch. You know, fascinating stuff. So, um, I'll say, it is a fascinating subject,
Hmm.
and I'm really glad you could come on and just kind of put some clarity to all this. You know, and give people additional options. So let's talk about for a minute as we kind of wrap things up here. Like, from your standpoint, like in a nutshell, like what are you doing for people? How can they get in touch with you? How can you help them? What just kind of let's
Yeah.
condense that into there so people can take action.
Sure. Yeah. I'd love to tell your listeners about a documentary we produced last year. It's called It's Not Personal, It's Just Healthcare. And it's not, it's, you'll see me in it for like 45 seconds just to open the film up, but it's going to be physicians and hospitals and attorneys and state-run healthcare plan administrators and nurses and former insurance executives. So everybody's kind of speaking on what they see internally as the problem. And then it also lays out kind of like a framework and an understanding for improving this because it's getting done every day. It's been getting done for 20 years, right? So these solutions are out there. So I think that's a great place to start. It's about 70 minutes. I promise you watch the first 5 minutes, you'll be sucked into the whole thing. Whether you just, consume healthcare as an employee at a company or you're actually part of this decision-making process. I've had a lot of people just watch it and then forward it to their benefits committee, to their CEO, CFO, HR, and had them engage with me and say, like, yeah, I all this stuff, I heard that at renewal. Like those are all the problems I face.
Right.
So that's on my website. I think that's a really great start for anybody to kind of understand the problems and the solutions. So it's on my website at ethosbenefits.com. It's under the little drop down of resources, and then you can stream it online at no cost.
That is awesome. Good for you.
Yeah, I'm so proud. It's such a
I
great
mean, that had to be so, man, that's a 70-minute documentary is no little bit of work.
Yeah, yeah. Luckily there was a team of us, right? So I was just a producer on it and we had a director and it was a good year-long project, but in my ecosystem, I already, I know all the
Yeah,
players. Like I know the pros, I know the people that are solving this kind of stuff. So it's just a matter of kind of getting everybody together and getting it done.
that's exciting. I'm going to check that out for sure. And I recommend other people do too, because you got to start with educating.
Yeah.
Like I was the knucklehead who's not taking someone else's, you know, willingness to give me at least a comparison bid. Okay, so I
Yeah.
operated at a really low level of stupid, maybe a high level of stupid. I don't know, but it was, you want to get educated, and I do that often now. That's kind of one of my whole things. I mean, I watch a lot of stuff. I read, just to bring in the knowledge. I have great guests on like you, which I love because that's my high speed pipeline to
Mhm.
information. Okay, I get here right from the proverbial horse's mouth, right? So, but really awesome. So everyone, check out that documentary for sure. That's great. Reach out to Donovan here. Let's save some money. Let's
Let's
get
do it.
let's make things work better for our people, for our business, and everything else. And Donovan, it's just been awesome. Just awesome to have you on. I really appreciate you taking the time today, for the audience and myself. And any parting words?
I'd say in my business, what we focus on internally and how we work with clients is be a fiduciary first, right? Like if you're in this decision-making process, you have that legal standard of care, but also it should just be a personal standard of care to take care of people, to act in their best interest and to be prudent. So I'd say let's just strive to do that and make better decisions than we did last year, and we'll get there little by little.
I love it. I love it. Words to live by. All right. And for everyone else, we'll see you on the next STS podcast. Thanks for tuning in to Sharpen the Spear podcast. If today's episode helped you think sharper, act smarter, or see new profit potential, do me a favor. Share it with a fellow home service owner and leave a quick review. Ready to find the profit hiding in your business? Head to sharpenthespearcoaching.com and book your free profit discovery call today. And until next time, keep sharpening.